Welcome to Podcasts on Demand, a continuing medical education activity. This activity includes the most recent and current clinical data presented by leading experts. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the podcast description that can direct you to this information.
Hello, I am Dr. Amesika Nyaku, an assistant professor at Northwestern University Feinberg School of Medicine. Welcome to Clinical Clips from IAS 2025, Episode 2 of 4. First, I want to talk about presentations about HIV treatment and prevention in children. So the Odyssey trial looked at children on first-line ART to understand what characteristics, such as anthropometric markers, HIV markers, hematology, and demographic characteristics predicted treatment failure. Among the 381 children with a median age of 10 years, dolutegravir-based ART had a lower risk of treatment failure. In terms of predictors of early treatment failure, children that were younger age had a lower BMI for their age, had a lower CD4 count at treatment initiation, were associated with an increased risk of treatment failure. So taken together, this information strengthens the evidence for the use of dolutegravir in pediatrics, and it also serves to identify characteristics that clinicians should pay closer attention to help identify children that may be at higher risk of treatment failure. The second abstract is PED-MAB1 trial. So this study looked at whether two different broadly neutralizing antibodies were safe, tolerable, and what was their PK profile. So 48 babies were distributed across 7 dosing groups. 5 of the dosing groups were a single broadly neutralizing antibody, and 2 of the groups used a combination of the 2 broadly neutralizing antibodies at different doses. The broadly neutralizing antibodies were safe in all of the different dosing groups, with generally mild to moderate adverse events that the majority were unrelated to the study product. And importantly, there was little reactogenicity from the broadly neutralizing antibodies. In terms of the pharmacokinetic profile, this suggests that dosing would be feasible every 3 months. These are promising results and opens the way for more work to be done, looking at the role of broadly neutralizing antibodies in the neonatal population. So now I want to talk about the efficacy of HIV oral treatment when dosed less than daily. So first, we'll start with the systematic review and meta-analysis of the efficacy of intermittent antiretroviral therapy dosing, a crisis response to the sudden cuts in USAID and PEPFAR funding. So 8 randomized clinical trials were included in this analysis, and that involved approximately 1,300 individuals. About a quarter were women. All the studies, except for the breather trial, were in adults, and the studies were primarily conducted in high-income countries. Viral load monitoring was approximately every 3 months. Virologic suppression was non-inferior in the intermittent ART dosing as compared to the continuous daily dosing, and there was no difference between the groups in terms of the development of treatment-emergent drug resistance, and there was no evidence of increased inflammation in the groups that had less than daily HIV treatment. And so in the setting of the global HIV funding cuts that have impacted antiretroviral therapy availability, intermittent ART dosing can stretch existing ART supplies. However, there's some important data that was also presented that should give us pause in trying to think about how do we generalize the data from this review. So this takes us to the short cycle antiretroviral therapy with weekends off is inferior to continuous ART in adolescents living with HIV receiving tenofovir disoproxil fumarate, lamivudine, dolutegravir in sub-Saharan Africa, the breather plus 96 weeks results. So, as I had previously mentioned, the breather was included in the systematic review. In that study, they looked at efavirenz-based regimen. In the breather plus, they're looking at a dolutegravir-based regimen in adolescents. Viral load monitoring was every 6 months. And so what they saw in the intermittent dosing was that 10% had virologic failure as compared to 5% in the continuous treatment arm. And so this was a hazard ratio of 2.1. So one of the leading hypotheses for why intermittent dosing with TLD is inferior may be related to the difference in the pharmacokinetics between dolutegravir versus our non-nucleoside reverse transcriptase inhibitors. And so again, in this time where there's been drastic funding cuts that impact the availability of antiretroviral therapy, there isn't one clear answer to what to do in this setting. So now I want to shift to talk about some emerging HIV treatments. So the Impala trial evaluates the virologic efficacy of long-acting cabotegravir and rilpivirine in people with HIV living in sub-Saharan Africa with suboptimal HIV control. So all participants first took dolutegravir plus 2 nucleoside reverse transcriptase inhibitors for 3 months for virologic suppression, and then they were randomized 1-to-1 to either get injectable cabotegravir rilpivirine or continue on the oral 3-drug treatment. Virologic success was defined as having an HIV viral load less than 50 copies, and that occurred in 91% of participants on the injectable arm and 89.2% of participants on the oral arm. 5 participants, or 1.9%, on the injectable arm had confirmed virologic failure. All of the 5 participants were switched to oral regimens, and they suppressed. So injectable cabotegravir rilpivirine is non-inferior to oral 3-drug therapy in individuals with suboptimal HIV control and is well tolerated. And then one of the things that needs to be highlighted is that this study was conducted without the availability of baseline resistance testing. And so that further strengthens the evidence for the ability to use this regimen when we think about differently resourced settings. So now let's move into studies about HIV prevention. This study looks at the safety and PK of 3 different doses, a 3 milligram, 6 milligram, and 12 milligram once monthly dose of MK8527 compared to placebo in people at low risk for HIV-1. 350 individuals from 3 countries participated. Adverse events were similar across the study groups compared to the placebo arm. Most drug-related AEs were graded as mild, and there was no significant changes in lymphocytes or CD4 counts across the study products. Additionally, the PK dosing, the PK results showed that the dose response was proportional. And so this data supports the further development of MK8527 for HIV prevention. And so in fact, there are 2 phase 3 studies, Expressive 10 and Expressive 11, that are planned to start later this year. Another study is called Lessons Learned from the Introduction of PEPFAR-Supported Long-Acting Injectable Cabotegravir and Shaping Global Prevention Efforts. This is a retrospective study that evaluated PrEP uptake last year when CAB-LA was rolled out through PEPFAR support in 5 countries. And those countries are Eswatini, Malawi, Ukraine, Zambia, and Zimbabwe. In fiscal year 2024, over 440,000 people initiated PrEP, and approximately 127,000 individuals returned or continued on PrEP. PrEP initiation primarily occurred in country-specific key populations, and the majority of CAB-LA uptake was in new users rather than switch by people that were already on oral PrEP to injectable. The takeaway from these results are that more PrEP options increases uptake overall, as well as PEPFAR is critical for global expansion of PrEP, and funding disruptions will disrupt this progress. And so with that, I'd like to thank you for joining us for episode 2. Please refer to the landing page for slides and to claim your continuing education credit. Please be sure to come back tomorrow for our third clinical clip from IAS 2025.
We hope you found this podcast useful and educational. To receive continuing education credit and to download your printable certificate, please go to the activity page at practice.cme.com to complete the post-test and evaluation to receive continuing education credit.